Hello, my name is Mona Board. I'm the dentist here at the Health Lodge. Today I'm going to be talking to you about mouth breathing. What's the big deal? Before we do that, let's do our acknowledgement to country. The Health Lodge wishes to acknowledge the traditional owners of the land on which this presentation is being delivered, the Arakwal people of the Bundjalung Nation, and pay my respects to the elders past, present, and emerging. So how are you supposed to breathe? I'll tell you. Through your nose. Maybe you're not so conscious about it, and maybe you're thinking about it right now, but you should be breathing through your nose. So what's so great about nose breathing? Well, we're actually designed to breathe with the nose. So when we take some air into the nose, the hairs inside the nose will filter out any debris, any irritants, and then the mucous membrane will catch any bacteria and debris as well. The air is also humidified here. Then the next thing is the turbinates, which are shell-shaped structures at the back of the nose. They will warm the air to make it more comfortable to breathe. The nitric oxide is produced in the nose. It's a substance which is a vasodilator, which means it widens the blood vessels so that when we're breathing in with the nose, the blood vessels in the lungs are wider, and so they can take in more oxygen. Nose breathing also helps with correct facial growth by stimulating the maxilla, this bone, stimulating that one to grow. If we don't breathe with the nose, then this is less stimulated and it grows less, which can lead to crowding the teeth later on. Nose breathing also helps for better digestion. Because we're catching bacteria in the little nose hairs, as we spoke about, we're not breathing them into the mouth and then swallowing them down into the stomach. Then that's one way that it improves digestion. And then the other way is that it stops us from swallowing air while we're eating, so less burping and that kind of thing. And it's more polite to eat with your mouth closed, right? All right, so mouth breathing. What's the big deal? Well, mouth breathing is the body's plan B. So we definitely need to do it sometimes, but just not all the time. If we're using our mouth to breathe long term, then there can be some health implications. Because we're breathing with the mouth, we're not filtering anything out. We're getting all the bacteria and all the allergens going straight into the mouth. We're swallowing them into the stomach, and we're breathing them onto our tonsils and onto our throat. So we're going to have more respiratory allergies, more respiratory infections, and maybe even some digestive issues. We're also going to have a dry mouth all the time, so we're going to be thirsty all the time. We're going to have cracked lips because the air is not being humidified by the nose. The other thing is that we're going to have a low tongue posture. So because the mouth is open, the tongue sits low, which leads to small jaws in developing children. And this can lead to having crooked teeth and impacted teeth later on. It can also make us have a poor posture and poor breathing habits. We can breathe very shallow, kind of using this upper area rather than belly breathing. Dark circles under the eyes, even a deviated septum can be associated with mouth breathing. Also poor behavior and poor performance at school, usually due to the lack of oxygen that we're getting, because we're not getting that lovely nitric oxide, which is being created in the nose. Mouth breathing in adults and children will encourage snoring, sleep apnea, clenching, and grinding. Let's try this nose unblocking exercise together. Find somewhere comfortable to sit. Sit up quite nice and straight. You can close your eyes if you want to. Place one hand on your belly. Have your mouth closed. Have your whole tongue resting against the roof of your mouth. Take a slow breath into your nose, expanding the belly and keeping the shoulders relaxed. Breathe out slowly with the nose. Now pinch your nose and hold your breath. Once you feel a mild to moderate air hunger. Let go of your nose and breathe slowly in and out of your belly, still with your mouth closed, using your nose. Now repeat. You can repeat up to 5 times. And after the 5th time, feel how much free your nasal passages are when you breathe in with your nose. This is a great exercise to do as you're getting into bed. You may also want to consider mouth taping to get into the habit of closing your mouth while you sleep. This doesn't address the root cause, but it can help you feel more rested by the next morning. Is your nose still blocked? If so, you may need to see your GP or an ear, nose and throat specialist to see if there is a physical blockage impeding the smooth flow of air into your nose. So why are you mouth breathing? There are a few different reasons why people might mouth breathe. The first one being the tongue tie. There are 2 types of tongue tie, posterior and anterior. So the anterior tongue tie is the one that babies are diagnosed with when they can't breastfeed. It's at the front of the tongue, and it's simply snipped by a surgeon to release the tongue so that the child can latch correctly for breastfeeding. The posterior tongue tie is a little bit more hidden, a bit more difficult to diagnose. It doesn't hinder breastfeeding as much at all, and it's a little bit more delicate as a surgery to release a posterior tongue tie. But this kind of tie stops the entire tongue being rested against the roof of the mouth, which is where it should be. Then the next thing would be chronic dust, mold, pet hair, and pollen exposure. If we're breathing with the nose and we have these things constantly coming into our nose, we're going to create an allergic reaction inside the nose, get irritated, and it's going to be inflamed. We're going to revert to breathing through the emergency mouth. The next thing would be having too much dairy. When you have a dairy allergy or an intolerance, it does create inflammation and extra mucus in the ear, nose and throat kind of area, which can lead to respiratory tract infections, ear infections and tonsillitis. Patients will get a stuffy nose and they will prefer to breathe with the mouth, which then increases their chances of getting more respiratory tract infections and tonsillitis because they're breathing with the mouth. It's a little bit of a vicious circle in that sense. The last reason might just be that it's habit. Maybe everyone at home uses their mouth to breathe, or maybe when you were growing up, one of your parents was mouth breathing. So simply having this knowledge might be enough for you to close your mouth and breathe with your nose. So if you're feeling as though this was a useful presentation and that you want to talk more about it, if you are a mouth breather, or if you snore, you grind your teeth or clench, or if you have ADHD or your child does, or you have poor posture or crowded teeth, or you had teeth removed and had braces to make your arches smaller so that your teeth would fit in your small jaws, and you're feeling some breathing issues, then you can book in with me and we can have a chat about it and assess everything for you and see what we can do about it.